A very good morning to all the dear students. Let's start our lecture series. Before that, I want to remind you a very famous quote by none other than Swami Vivekananda. All the power is within you and you can do anything. Yes. The world, the cosmos, your teachers, your parents, everybody can support you to reach the ultimate, to reach your success point. But it's you who have to lay down the stepping stone one by one to reach to that extreme success. So buckle up. Each one of you buckle up and try to make yourselves shine in this field of dentistry and obviously in the world. So the topic for today that we are going to cover in this lecture is an introduction about blood, the compositions of blood, and we will be particularly talking about RBC and plasma proteins and their clinico-pathological aspects. Now, why do we need to know about this blood? We are all dental students. So, why blood is so important? Why I have chosen blood as the first topic? Because our degree tells we are Bachelor of Dental Surgeons or Master of Dental Surgery. So, when we are surgeons or we are doing surgery, the first thing that we see is blood. And actually, blood tells us whether to opt for an extraction or opt for an implant or opt for an periodontal surgery. Is that blood will tell you. Any small abnormality in the blood can ruin your hard work and your reputation and your practice. Therefore, to know the blood very well and to know which pathological tests of the blood needs to be run for a particular disease is very important. Otherwise, the prognosis of your treatments will go into vain. Like this newspaper cutting you can see on the screen, which was published in the Hindu on 31st December 2002, states, girl dies after tooth extraction at KMC hospital. Yes. Post-extractions, uncontrolled bleeding is a very major emergency in any dental practice. Before that, you need to know about the blood very well, about hemostasis very well, about the pathological aspects of the various features of blood. So this is one of the examples that I wanted to show you all. So what is blood? You can call it as fluid of life. It is known as fluid of growth. It is known as fluid of health. Why fluid of life? Because you need oxygen to live. And that oxygen is carried by blood. Therefore, it is fluid of life. Why fluid of growth? Because it is blood which carries all your nutrients to the different parts of the body. So, and its absorption of the nutrients, even excretion of your unwanted products, everything is done by blood. So, therefore, it is known as blood of or fluid of growth. And third, it's known as fluid of health because it is the one which has the immunity power. It is fighting with the diseases. So therefore it is known as fluid of health. So what are the properties of blood? The general properties. I think most of us know this, but still let's go through. Its color. Blood, as we all know, is red in color. But actually, your blood has two different colors. One is scarlet red, one is purple red. The blood that is there in your artery, that is the arteries and veins, the color is different. Arteries carries the oxygenated blood from your lungs, and veins carry the deoxygenated blood from the organs to the heart. Therefore, the oxygenated blood is scarlet red. That is, the blood in your artery is scarlet red, and the blood in your veins is purple red, because the oxygen concentration in the venous blood is less. What is the volume? The average volume of normal adult is 5 liters. In case of newborn baby, it is 450 ml. In case of females, it is a little bit more, that is 4.5. And approximately it is 8% of your body weight in any normal healthy adults. So how do we measure this volume of blood? There is normally 3 equations which gives you the normal blood volume. One is Nadler's equation, one is the reference book method, and one is the Gilcher's rule of 5. You don't need not know the calculations and in details, but at least you should know the names from your Viva point of view, or especially during your preparation of your NEET, MDS or any other competitive exams. At least you should know the names: the Nadler's equation, the reference book method, and the Gilcher's rule of 5. This Nadler's equation is nothing but 0.006012 into height, which should be in inches, plus 14.6 into weight plus 604. This is one of the formulas to get a person's blood volume. Next is the reference book method, that is body weight, that should be in kilograms, into 75 milliliter per kg, that is the average for men. And the Gilcher's rule of 5, as you can see, in a muscular it should be 75 ml per kg, normal is 70 ml per kg, thin is 65 ml per kg, and obese is 60 ml per kg. So these are the 3 different ways how to measure the blood volume. Now, why is this blood volume so important? Blood volume pathologically can become 2. Either it can be more or it can be less. So if it is more, then we call it as hypervolemia. If it is less, we call it hypovolemia. You will say, sir, we all know about this. Then what is new? Why we need to know what is hypovolemia, what is hypervolemia? Because this hypovolemia and hypervolemia is very, very important during our practice. A patient with a hypovolemia, that is less volume of blood, can even expire on your dental chair if he undergoes hypovolemic shock, which will be dealt later in the later lectures. We will talk about hypovolemic shock, how to treat it. But at least as for basic, you should know the volume of blood. You should be very much aware of the patient's volume of blood, because if the volume of blood is less or more, it can cause havoc problems, emergency problems during your dental practice. So normally, how will you understand if the patient is hypovolemic in nature? You will see the patient has the problem of thirst, tachycardia, that is increased heart rate, which you should measure before every dental extractions or dental procedures. Hypotension, the patient's BP will be reduced. He will have dizziness and fatigue, and obviously sometimes it can even have dark urine. Normally the treatment that we give for hypovolemia is fluid replacement, that is IV fluid to restore the blood volume, and identify and treating the cause. Why it is happening? Is there an internal bleeding, or it's because of any hemorrhage, or it's because of any other problems? If it is because of any type of reduced blood formation. So it can be hundreds of reasons. So why is it happening? That should be understood. And why you get hypervolemia? The hypervolemia, what are the symptoms? How you will understand the patient is having hypervolemia? Hypervolemia, you can mainly see the patients will have edema. In case of legs, ankles, abdomen, there will be swellings. Hypertension, as you saw in hypovolemia, it is hypotension, here it is hypertension. Shortness of breath, jugular vein distension, weight gain. Normally the treatment that is given is diuretics, minimizing the salt intake and treating the underlying cause. What are the properties of blood? See, the alkalinity of blood is 7.4. And this blood alkalinity is very important from clinical point of view, very, very important. These are some of the values that you should at least keep it in mind from your Viva and again competitive basis. The specific gravity of total blood is 1.05 to 1.06. Specific gravity of blood cells, that is your RBCs and WBCs, is 1.09 to 1.1. Specific gravity of plasma in 1.02 to 1.026. Now, what is viscosity? The viscosity of blood is 5 times that of water, that it is more viscous in nature. Now, as I told you, the alkalinity of blood is very important, because if the alkalinity of blood is not maintained, your body's acid-base balance is disturbed. So if the acid-base balance is disturbed, that is, if your pH is reduced, we get something called acidosis. And if the pH is increased, we get something called alkalosis. So what is the effect of acidosis in human body? The first thing that affects your central nervous system, you'll get headaches, sleeplessness, confusion, loss of consciousness, and even you can go up till coma. Next is respiratory system. What is the effect on respiratory system? Shortness of breath and coughing. The next effect is on your heart, which cause arrhythmia, improper pumping of blood, and increased heart rate. Muscular system effect is seizures and weakness. On digestive system, you'll already have nausea, vomiting, and diarrhea. If the pH is increased, it just causes the ulta of central nervous system. What does it cause? It causes confusion, lightheadedness, stupor, and again it can lead up to coma. On your peripheral nervous system, it causes hand tremors, numbness or tingling in the face, hands or feet. Muscular system, it causes twitching and prolonged spasms. And in digestive system, it can cause nausea and vomiting. So this acidosis and alkalosis has a huge effect on human system of your blood. So therefore, body has its own system of regulation of this acidosis and alkalosis. It tries to. If it at all cannot, then you have to give a external support. You have to go to doctors and you have to take patients to the hospitals, and lots of procedures are there. But body has a self mechanism, and that is very important from your exam point of view. That is, if the acid or base homeostasis is disturbed, that is, if your pH is reduced, you will have acidosis, that is already I told you. So what happens if acidosis happens? How the body's self mechanism works? Let's see that very clearly. So once acidosis happens, it stimulates the brain and the arterial receptors. There are certain arterial and brain receptors which is there to receive if there are minute changes in the alkalinity or pH of the blood. If there is certain change, those receptors are like your CCTV cameras. They're already present, which once initiates, which will first do is it will increase your respiratory rate. You will suddenly start taking long, deep breaths, which will obviously increase your oxygen and reduce your carbon dioxide level in your blood. Obviously, if you are taking more and more respiration, you're inhaling more of oxygen, you're inhaling more air, your oxygen level reduces and carbon dioxide level, oxygen level increases and carbon dioxide level reduces, which will obviously reduce the H2CO3 level in your blood. Since the carbon dioxide is leaving, the next step after mixing of carbon dioxide in the blood is the formation of H2CO3. So the H2CO3 in your blood will automatically reduce, and once the H2CO3 reduces, that is the alkaline thing reduces, the pH will increase. In case if your pH is increased, that is, if in case we get alkalosis, again those receptors that are present in your brain and are present in your arterial receptors, those will get instigated. They will reduce your respiratory rate so that you can take more amount of carbon dioxide. So one carbon dioxide increases, your bicarbonate level also increases, which will obviously decrease your pH. So the acid base homeostasis is restored. This is a cyclic process that keeps on happening in your blood. As we know, what is the composition of blood? We all know composition of blood is extracellular fluid and intracellular fluid. The most important difference between these two compartments is their concentration of protein in the plasma. Here we will be knowing something known as Donan effect. What is all this about Donan effect? The concentration of the positively charged ions, that is the cations, is slightly greater in the plasma than in the interstitial fluid. See, as you have read during osmosis or during diffusion, that higher concentration to lower concentration, always ions move from higher concentration to lower concentration. So this Donan effect is explaining that the positively charged ions, that is the cations, is slightly greater in the plasma. That is, in plasma their concentration is more rather than in the interstitial fluid. Why is this important? Why am I talking about this Donan effect? Because this Donan effect helps in three things. What are those three things? Firstly, it helps to maintain the capillary diameters, arterial venous diameter, so that the ions from inside the plasma doesn't flow into the extracellular fluid. Therefore, it helps to maintain the capillary diameters. Secondly, it helps in the nutritive functions, that is, in delivery as well as absorption of your various nutrients that is present inside the blood. And thirdly, it helps to maintain your flow of blood. So therefore, this Donan effect is very, very important. Now let's come to what is called as composition of blood. We all know that blood is 80%, 8% is blood, and other fluids in the tissues are 8% is blood, and other fluids are 92% of your total body weight. In that 8% blood, we have 55% as plasma and 45% as formed elements. Plasma 55% consists of 7% proteins, 92% water, and 1% of other solutions. Among the proteins, we know about albumins, globulins, fibrinogens, prothrombins, and other solutes we see ions, nutrients, waste products, gases, and respiratory substances and regulatory substances. Among the formed elements, we have RBCs, WBCs, and platelets. The compositions and amounts will be again later discussed in details. Now, how do we get that in a human being's blood is this percentage normal? That whether he is having a correct amount of volume of this RBC, WBC, plasma and everything is what we call as the hematocrit value, which tells you the packed cell volume level. So what is this hematocrit? The hematocrit is the fraction of the blood composed of RBC as determined by centrifuging the blood in a hematocrit tube. So when you see the hematocrit tube in a normal blood,